All right, Stacy. So thank you again for meeting with me today. I'm just going to get
Mhm.
started and jump right into our questions. Can you
Okay,
begin by briefly explaining Gateway CSP and your role there?
sure. Gateway Community Support Program is a program that serves adults with severe and persistent mental illness. Our goal is to assist individuals with maintaining mental health stability while remaining as independent as possible in the community.
Okay, great. And how did you learn ASL?
So I learned ASL when I first started. I have worked here at Gateway for 22 years. So when I first started, they were looking for a case manager who was open and willing to learn sign language. So I learned by submersing myself into the deaf culture and going to the deaf club and being taught sign language by individuals who are deaf there.
Mhm.
The president of the deaf club, who is well known in the deaf community here, then came to work here every week and worked with a small group of us who were open to learning sign language. I got some basics in place and started working with consumers here who were deaf.
Mhm.
Um, Honestly, most of what I know, I have picked up though in direct communication with our clients and have really figured out a lot of it just as I've gone along.
Okay. Are there any words or phrases that are more unique to your work that may not be understood by other individuals who communicate with ASL?
Yeah, I think one point to make with the consumers I've worked with, I work with one individual who is blind and deaf. So we have to do something called tactile signing where I sign into his hands. So that's an additional piece of ASL that I've basically had to teach myself. With him and with that method, we tend to do a lot of finger spelling versus using actual signs. Um, but what I can say is and I think I have worked with probably 6 or 7 individuals over my course of working here, um, who have been deaf, and each consumer has a unique way of using various signs. Some of these signs are not always accurate, nor do they always make sense. I typically know what they're trying to say based on my years of working with them and just knowing them. And I will say some of our older population of deaf consumers sometimes use signs that are not commonly in practice in the ASL language anymore. Specifically, there might be some signs that have different sign for ethnicity or a racial term that they learned differently just because of their age.
Okay, great. What are some challenges you've experienced working with deaf individuals with severe mental illness in the community?
So over the years, I've encountered lots of challenges to working with deaf individuals with mental illness in the community. And I kind of came up with a couple examples I can share. I typically have to strongly advocate for interpreters at appointments. One would think this is assumed, but oftentimes clients show up for appointments, no interpreter was scheduled or available. There, at least here in Wisconsin and Madison, there is a huge shortage of ASL interpreters, probably interpreters in general. We recently had a client tour a care facility. He had some questions, didn't understand some things they were talking. So we, as the case manager, asked this care facility to hire an interpreter, and they declined to do so. Um, Unfortunately, I think we come across this more often than we should. I think it's just the reality um, of where things are at. Our resources are already slim for individuals with mental health issues. Um, so throw in individuals who also are deaf, and I think resources are pretty much non-existent. Um, the world we live in assumes everyone has access to technology, which they don't. Our clients don't have phones they can text from or consumers where they can access an interpreter through.
Mhm.
We have one individual right now living at a motel. They don't have any adaptive equipment in place, such as a light if you need to ring their doorbell or if there's a fire. His condo had these devices in place, but this low income motel doesn't and is not really open to doing any of these things.
Wow.
Yeah, so just a few examples of challenges. I bet you in my years here I can come up with a lot more, but definitely we encounter challenges all the time.
Yeah. Have you found that severe mental illness or psychosis present differently in individuals who are deaf and like versus those who are not?
I think this is a really good question, and I think it's a conversation I've at least had with myself and other staff over the years about what do symptoms look like for our individuals who are deaf. For example, when our clients hear voices, what does that look like
Mm,
as individuals who've never experienced sound in their life? I am fairly certain, based on questions I have asked folks over the years, that their voices don't sign to them, but instead do talk to them.
hmm,
And again, I think just as a, professional who works with this population, it's just an ongoing question, thought as to what that looks like. Also, the individual I mentioned before who I work with who is blind and deaf, I think at baseline, anybody who perhaps is dealing with that might have some level of paranoia or trust issues. But then factor in this individual also has a diagnosis of paranoid schizophrenia. Um, that's an additional challenge on top of all of that. So I will say too, I think in general, our population, the deaf population, won't always seek out mental health services. I will say every time I have an appointment, an interpreter might comment, oh, I know so-and-so that would greatly benefit from working with you. I think in a perfect world, there would be therapists and case managers out there who are deaf or hard of hearing themselves and could provide, services using ASL as the primary language. But again, that's just not where we're at in this world.
yeah. I
Mhm.
know kind of in general, we've identified that social barrier presents or social support presents as a barrier to mental illness. What has your experience been with your deaf client social supports?
Yeah, so of all of the individuals I have worked with, they have few, if any, social supports. One individual does have some siblings in his life. They provide minimal supports. I think that's more based on what he's wanting versus what the family is um, willing to do. But probably everybody else I have worked with, they've had no outside social supports aside from working with me and this program. Um, our folks don't attend the Deaf Club, which we have here in Madison. They don't attend any social gatherings associated with the deaf population, deaf culture, which there are a lot here. Um, I've found that this is very common among this population as they are already isolated because of their mental illness. So they're probably the last people that are going to reach out to have some social contacts within the deaf community.
Mm, okay, and then just my final question, what are some common misconceptions people might have about working with deaf individuals in the mental health setting?
I think there are so many misconceptions about individuals who are deaf in general, not to mention those with mental illness. Um, At appointments in the community, I often have to redirect providers, doctors, nurses, et cetera, back to talking to the client versus directing their questions, comments towards me as a social worker or the interpreter.
Mm,
I often get asked, many people cannot fathom how individuals live independently. And these are truly well-meaning people. Perhaps they're more in awe of the challenges that these individuals face. Um, I find myself often reminding people that the individuals we work with who are deaf have grown up and lived in a hearing world. They are fine. They figure it out. They've had to do this their entire life. Um, So I will say this is a very resilient group of individuals I have had a privilege of working with over the years, just in terms of being deaf and the challenges that face, but also, having a significant diagnosis on top of that.
Right. Okay. Well, thank you so much for taking the time to meet with me today. I really appreciate it.
You're welcome.